Hello students, I will show you a clinical test rather than a case scenario today and find out what this clinical test is. Very commonly used test. Just see what is this test. See that? This is the important thing. Gives a clue what this test is. So this is check for the movement with the deglutition specifically for thyroid. All of you know that thyroid moves with the upward with the deglutition. So this is the clinical test who say that swelling in the anterior aspect of the neck is thyroid. So why this moves? We got a pretracheal fascia, which is a false capsule of the thyroid, and upper posterior aspect of the pretracheal fascia is condensed and attached to the cricoid cartilage. Cricoid cartilage is attached to the inferior constrictor muscle and other constrictors, and when during swallowing, constrictor moves. Also, when constrictor moves, cricoid moves. When cricoid moves, because of this Berry's ligament, condensed pretracheal fascia, which is very close to the thyroid. So thyroid also moves upward with the deglutition. That's the reason why thyroid moves upward to the deglutition. It is very commonly asked question when you present a long case thyroid. The test to say this is thyroid because thyroid moves with the upward the deglutition. Why it moves? These are the reasons. So that's why this test is very, very crucial. Berry's ligament, what is it also they will ask. You should remember. So Berry's sign is the malignancy thyroid in advanced carcinoma. It encases the carotid sheath, so carotid pulsation is not felt. That is called Berry's sign. This is Berry's ligament, which allows the thyroid to move upward during deglutition. So students also go through my video about Berry's ligament is there, about male thyroid is there, about thyroidectomy is there, about briefly different tests in the thyroid also there, different aspects of the thyroid also small videos are there. Please go through that search and go through that. It will be more information about the thyroid, including Berry's ligament, thyroidectomy, male thyroid different tests, so many things. So please go through that also to have a better idea about the thyroid as such. So I already told Berry's ligament moves, why it is so. This gives the whatever they have told is written here, complete explanation, very, very useful. It's an MCQ question, why what they will ask. Theory also you may have to write this answer. And so read my chapter clinical methods in surgery about the clear explanation. Also my manual of surgery gives a clear idea about thyroid anatomy, different aspects of the thyroid, thyroidectomy, different conditions, everything in detail. You can go through that and answer the MCQ. The plumber's disease, primary thyroidicosis, secondary thyroidicosis, autoimmune thyroiditis, papillary carcinoma thyroid. So students, put the right answer. I acknowledge you, appreciate you for the answer. Put the answer in the comment box later and answer another MCQ. Pre-tibial mixed edema is usually seen in primary thyroidotoxicosis, secondary thyroidicosis, toxic nodal toxicosis. Again, all these MCQs are commonly asked in your exams, NEET exam, competitive exams. So remember this, put the right answer, we'll have a correct answer later. Quotation of the day, student, give without remembering, receive without forgetting. Whatever you have given, don't remember it. Whatever you received, always remember. Always acknowledge whoever given to you something. That is the point what exactly this quotation says. Students, please go through my SRB's manual of surgery, SRB's clinical methods in surgery, and SRB's operative surgery, surgical atlas. The new edition has come, and atlas of steering technique. Manual gives everything in detail about all topics as per CBM syllabus, general surgery, gastrosurgery, urology, neurosurgery, cardiothoracic, and basic instruments, specimens, brief operative surgery, which is essential for UGs. Everything is covered with the quotations, with the illustrations, the diagrams, photos, covered everything as for CBM syllabus. And clinical methods in surgery, current edition gives a proper clinical idea, approaches to all cases, briefly orthopedic also. Again, it contains instruments, specimen, images also, and videos. Each chapter videos are there, how to examine a patient, which is very important when you do a practical exam, clinical exam. So very, very useful, everything, with again, lot of photos and proper methodology of examination with the differential diagnosis tables are given. So it will be very, very useful. Of course, operative surgery is a very detailed, 2-volume, extensive book with more than 10,000 photos and illustrations. Whenever you want to, any surgery, including specialty, general surgeries, gastrosurgery mainly, in detail it is given. It will be very, very useful. So students also go through my SRB's Surgery Insight YouTube Insights, and please subscribe for all these lectures, daily lectures for brief 6 to 10 minutes, and live sessions once a week or once in 2 weeks I am doing. They're also very, very useful for students with with the interaction with the senior faculties are there, and always they can answer your doubts and through chat. So please subscribe my channel, YouTube, Instagram to have a better knowledge and increase your surgical knowledge as such, because it is free also. And my DigiNow lectures through JP, around 220 lectures covering everything surgery, including specialty, operative surgery, clinical methods also, with the videos through JP Publishers. And you can always purchase that one for 1 year, so that you can have go through all lectures with a very clear idea about the subject to face any exam, including NEET or final year exam or even PG exams. So students, I hope you understood this lecture very well. Thank you so much.